Hello and welcome. There are a few things that I want to start off by covering before we dive into the course content. And the first is I just want to say thank you. Thank you for taking your time and your precious resources to learn more about such an important topic, feeding your baby. So throughout this course, I'm going to refer to your baby, but I do recognize that maybe you're a grandparent or you're an early intervention professional or a daycare worker or an aunt or an uncle or a babysitter. Whoever you are, if you're involved in the life of a child, you're in the right spot. So welcome. I created this course because I know how confusing and how stressful introducing food to your baby can be. Almost every parent's going to have a question or two, and more likely dozens of questions about introducing foods. And so often what happens is you go online and you search for answers and you find one person who says to do this and a blog article that says to do another thing. And then there's a group of parents over here that swear by this other approach, and it just gets really confusing and overwhelming. It's really tough to get the full story from a professional in the field of feeding, and honestly, a lot of people don't even realize that that is a field of study and a field of practice. It's a big deal to take your baby from an all-liquid diet to table foods in the span of just a few months, really. And it can be really reassuring for parents to hear from someone with training in this area, and that's really why I created this course. I'm a lover of the great outdoors. I'm a mountain biker and a whitewater kayaker. My husband is a rock climber, so I really like to use the metaphor of hiking up a mountain to describe baby's first year of eating. Without the right gear and a good trail map and maybe some understanding of what you might face on the trails, that journey could be tough and it could be a little bit scary. But with a little preparation, that same journey can be enjoyable and it can be memorable. It can really help you build your relationships and it can be fun. So like taking a hike up a mountain, there are several paths that we could take to get to the top. And to me, your baby eating table foods, just like the rest of your family, that's the top of the mountain that we're striving for. What you won't find in this course is a complete baby feeding program or a system. Instead, I really want to offer you expert information and some resources and recommendations that will help you really respect and respond to your individual baby's mealtime needs. I really want you to find the best path for your family to travel together. So consider this your field guide for that journey. I want to start by touching briefly on my experience with baby feeding so that you know a little bit more about me. You probably know by now, but I'm Rachel Coley. I'm a pediatric occupational therapist, and I'm a mommy. Here I am with one of my little ones. I've devoted much of my career to working with infants and toddlers. Those youngest years are really my passion. And because mealtime challenges are one of the big reasons why children that little receive occupational therapy, I started early in my career taking some additional courses and training in this area, and I was really surprised to learn that I love feeding therapy. I took more and more courses, and I was taking on more and more complex feeding patients and really enjoying it. And then I had one parent who really changed everything for me and changed my heart on the subject of feeding. So this mama's son had a complicated medical history. He'd been a preemie, and he was having a really hard time transitioning onto food. Maybe some of you guys can relate to that. At about 11 months, when I first saw him, he hardly took any more than just a tiny taste of pureed food a day. And then adding to that was some more stress that he actually needed a kidney transplant, and that required him to meet a certain weight goal. So if we couldn't get him eating solids soon in occupational therapy, he was going to have to get a feeding tube. So no pressure, right? He responded really well, I'm happy to say, to his feeding therapy, and he was eating great in our OT sessions. So I was really happy. His mom seemed really happy. Things were going along just fine. Well, at one appointment, his mom asked for a third feeding therapy session a week, which is pretty much unheard of for insurance to cover. So I knew it wasn't likely to happen, but I wanted to know why. So I asked her, why do you need another therapy session? He's doing great. And she started to cry. And my heart just broke in that moment. What she told me is he's eating here and he only eats for you. So he wasn't eating at home and he wasn't eating for his mom. I realized that by doing the feeding myself, sure, I'd helped him make some really rapid progress and that was great, but I had also robbed this mama of such an important role in her baby's life. And it really hit me that day, and this was years before I had kids of my own, just how primal and how emotional it is to feed and nourish your child. I realized how important it is for a parent to feel competent and confident at baby meal times, and everything in my feeding therapy changed that day. I shifted my role with the families that I worked with. They were the baby feeders, and I was the guide from then on. I had hiked these trails many times before, but I couldn't hike for them. Instead, I supported them on their journey and helped them find their own path, just like I'm going to do for you in this course. So after years of working as a pediatric OT, I had a few babies of my own, and I got to switch roles. So suddenly I wasn't the feeding guide, I was the feeding parent. And my two babies could not have been more different when it came to foods. What worked for one, of course, didn't work for the other. So I had to really use so many of the different tools and strategies that I'd been teaching parents throughout the years. But I've had fun. It hasn't been stressful. It hasn't been scary. It's been messy. And definitely mealtimes don't always go as I'd planned or expected. But ultimately, helping my little ones progress from that liquid diet to taking big boy bites and big girl bites at the table with us at dinner, that has been one of the most fun and rewarding aspects of parenting for me. And that's what's in store for you too. The title of this course comes from a common saying, at least among parents here in the United States, and maybe you've heard it. It goes, "Food before one is just for fun." Time and time again, I've heard this and read this offered as a response to a parent who's struggling with baby meal times or has baby feeding questions about their child. I think that this saying probably was born from the idea that before one, your baby's primarily getting his calories by breast milk or formula, which is absolutely true. And I definitely agree that food before one should be lots of fun. But there is an end goal. We aren't just wandering aimlessly in the woods here. We've got our sights set on that mountaintop view we've talked about. You'll know you've reached that goal when your baby's eating table foods with the rest of your family. I worry that this food before one is just for fun saying is getting misinterpreted and misused sometimes. I think it's really easy for parents to hear from it that it doesn't really matter what their baby does with food before the age of one, or that food before one doesn't really serve a purpose, and that it's okay to ignore feeding challenges that might crop up in that first year of life. The danger of this just for fun mentality is that it opens the door for issues like a 12-month-old who's had extremely limited exposure to different textures and tastes and temperatures, or a 1-year-old with delayed oral motor skills because they really haven't had enough practice, or maybe a toddler who's not developmentally ready to shift their primary source of nutrients to solid foods, or that baby whose red flags for feeding problem have been missed or dismissed for months. And what that does is it loses valuable time for intervention. Those are all really common scenarios that I see as a feeding therapist, and they're ones I really want to help you avoid. So what is the role of food before one? It offers important opportunities for your baby to refine oral motor skills. Now don't panic. That term oral motor skills, it just refers to mouth coordination. So just like your baby learns to roll and crawl, he also has to learn to move his mouth. So he's going to learn to move his tongue around, to close his lips on a spoon, to mash food between his gums. So feeding is a set of skills, and they require practice. Practice that food before one provides. Food before one also provides important practice for hand-eye coordination and grasping skills. If you think about it, because of choking risks, we don't really give our babies very much practice handling itty-bitty little things, so finger feeding can offer them that practice in a safe way. Food before one is important for sensory development, that is, for helping your baby learn to perceive the size and the shape and the texture and the temperature of different objects, both with his mouth and also his hands. It also helps him to experience the smells of food and gives him chances to really learn what feels good and what feels yucky to his hands and his mouth and what feels safe and unsafe. And while it's true that your baby will still receive the bulk of his calories from breast milk or formula, food before one can provide your baby with some really important nutrients that we'll talk about, like iron and vitamin D. Not to be overlooked at all is the fact that early feeding lays a foundation for really a lifelong relationship with food. How this early feeding experience goes down can really answer questions for your child like, is it pleasurable to eat? Is trying new food scary? Is it okay to be messy? Are mealtimes power struggles with my parents? Do I know what it feels like to be hungry? Can I stop eating when I'm full? This is really important stuff, and we don't want to just brush this aside as merely fun. Food before one is also a time of transitioning from the individual meal times of an infant, whether nursing or bottle feeding with one caregiver, to meal times with friends and with family. Food is so social, and really it's that second half of your baby's first year of life when that social element starts to come into play. And finally, like I talked about with my little feeding therapy kiddo and his mommy, food before one can just really shape a parent's confidence. If you don't feel like you know what you're doing with feeding, or you feel like your baby hates meal times, several times a day you're going to be stressed. And that could go on for years. Instead, I've seen it with my own eyes that parents who really feel good about meal times and feel like they're helping their babies to enjoy food, they feel confident and they get that boost several times a day, every day. Because I'm a child development nerd, I can't help but also mention a little bit of relevant research. So studies show us that there are some developmental windows, which are like periods of time, when a baby is most ready to acquire new feeding skills. And to give your baby the best start possible with foods, it's really important not to miss those windows. You can think of it like planning to take our hike during daylight hours. It's not impossible at a different time, but that path is going to be a lot harder. Research also indicates that feeding problems and poor growth in baby's first year are highly correlated with eating problems throughout childhood. So we want to pay attention to any red flags or challenges that baby's having with feeding. The take-home message here is that food before one should be really fun, and it's really important for many areas of your baby's health and development. All right, so just so you guys know a little bit about what's coming up in the course, I've structured the course into two main parts. Part 1 is really about preparing for the adventure of feeding. We're going to talk about how to know your baby's ready, how to choose baby's first foods and gather all your feeding supplies, and some questions people often ask about how much to feed and when to feed and how to prevent choking. And then part 2 is really the journey. This is where we're really going to get into the nuts and bolts of how to physically feed your baby and how to transition through different textures of food, how to help your baby use utensils and drink from straws and cups. I really encourage you this first time through to definitely take part 1 of the course in its entirety, even if you've already started feeding your baby and you're just at a stuck point. Then you can use part 2 to specifically tackle any topics as they come up. So if your baby hasn't even started eating yet, you may not want to worry about how to teach using a fork or how to teach drinking from an open cup. You can use those lessons in part 2 as you need them, but part 1 is really an important foundation for everyone to have up front. I've also put together for you what I've called the printable field guide, and that's really your companion for this course. In it, I've included tons of additional resources, key points to remember from each of the lessons, and some of those feeding products that I recommend are referenced throughout the course. For your convenience, I've included that printable field guide on each lesson page, but just know that it's the same document each time you see it. All right, for simplicity's sake, I won't be bouncing back and forth between the pronouns he and she. Since most of the images and video in this course are of my baby girl, I'll actually be using the pronoun he throughout for the sake of gender equality. Friends, without further ado, I will see you over in lesson 1, where we'll see if your baby is ready for food.